Thank you, Mr. Chairman, and thank you for conducting a hearing on what I suspect is the most serious problem facing the people of the United States. And I think in my own state of Vermont, we have held a number of public hearings in small towns on the health care crisis, and we have been amazed by the number of people who have come out and who have said the present system is no longer working, we need a major overhaul, no more tinkering, we finally must go to a national health care system which guarantees health care to every man, woman, and child. I'm sure that you are familiar with the enormity of the problem. The system is disintegrating. 35 million Americans today have no health insurance. What happens to those people when illness or accident strikes? 50 million people are underinsured, can go bankrupt as a result of a major illness. We rank 22nd in the world in terms of infant mortality. We rank 12th in the world in terms of life expectancy. Is that being #1 in the world? I think not. And after all is said and done, for a system which is disintegrating, we end up spending far, far more than any other nation on earth. The Canadians, who are in second place, are spending 30% less than we are. Clearly, to my mind, the system cannot be tinkered with. We need a major overhaul. We need to do what virtually every other nation on earth has done and move toward a national health care system. The proposal that we are bringing forth is, in fact, a Canadian-style system, administratively and politically. As I believe Congressman Russo or Congressman Markey indicated, Canada did not move to national health care full-blown in all of their provinces. It started in Saskatchewan. My own view, and what this legislation proposes, is federal and legal authority, federal aid, increased federal money, and legal authority for those states in the country which are prepared to move forward now with a single-payer system, which is comprehensive, covers all health care needs, universal, covers every man, woman, and child in the state, is portable, allows that insurance to go when people go out of their own state. If the state is prepared to do that, they will receive a block grant which brings together Medicare, Medicaid, and additional funding. As others have indicated, it seems to me to be senseless to move forward without eliminating the private health insurance companies right now, who are costing this country, according to the General Accounting Office, $67 billion in administrative and bureaucratic waste. We no longer can afford all of the billing excess, all of the bureaucracy, all of the legal fees that presently exist. Physicians for National Health Care estimate that the savings would be $100 billion, and they're using more contemporary figures. The fact of the matter is that we can provide health care, comprehensive health care, for every man, woman, and child without spending one penny more than the $750 billion we're presently spending if we take the money out of paperwork, out of bureaucracy, and we use that to provide health care for our people. Now, this issue of health care, to my mind, Mr. Chairman, is not simply a health-related issue. This is an issue of the political credibility of the United States Congress. It is not an accident that in the last election, 65% of the American people did not bother to vote for Congress. The question that the people are asking is, given the enormous problem facing the people of this country in health care and in other areas, is this Congress capable of standing up to the insurance companies, to the drug companies, to the medical specialists, to the medical equipment suppliers, the people who are making billions and billions of dollars off of a system that is disintegrating before our eyes? Now, the beauty of the system that we are proposing is that administratively it allows the states to move forward. And I believe, as someone who was a mayor for 8 years, that I would rather see the single-payer system rest in the hands of the state legislature, of the people of the state, rather than the federal government, which is precisely what goes on in Canada. Also, rather than raising all of the money at the federal level, we give discretion to state governments. California may want to raise their share of the revenue different than the state of Vermont, and we think that's appropriate. Each state should have that option. So essentially what our plan does is provide additional financial help for those states who want to go forward in single-payer, comprehensive, universal care. We give those states the discretion of raising their share in the best way that they believe that they can do it. So we think that politically, that is a sensible approach for this body. Because quite frankly, although I've been only here for 6 months, I am not quite sure that tomorrow the United States Congress is prepared to move forward in terms of a shifting of the tax burden to the tune of many, many hundreds of billions of dollars. So we think administratively and politically, single payer administered by the states is the proper way to go. We think it's politically feasible. We look forward to your support. Thank you.
Thank you very much, Mr. Sanders, and I'm pleased that Congressman Gibbons is with us. We were informed earlier he wasn't going to be here. We have your statement already in the record, but we're delighted to have you here to make a presentation to us. We'd like to ask, if you would, to limit the oral presentation to no more than 5 minutes. There's a button on the base of the mic. Please push it forward.